The AI revolution is well and truly underway, and while many of us are thrilled about the possibilities this may bring, it also has others quaking in their boots.
Now what are we gonna do?
Italy has banned ChatGPT, and a bunch of AI researchers have written an open letter demanding for all AI research to be paused immediately because they're afraid it is already on a trajectory to overtake human intelligence.
Skynet. We're talking about Skynet.
And honestly, I'd always assumed that as a doctor, the threat of artificial intelligence taking my job was a long way off. But the tools that have been launched in the past year are honestly so astounding that they even have me sweating. Diagnosing cancer is important for many obvious reasons, and the earlier we can detect it, the better the prognosis. But if we scan a patient looking for a cancer, there is a chance we may miss a small one in its early stages from time to time. But what if we could use AI to help us out? Well, several studies have shown that AI algorithms can actually outperform human doctors in detecting cancers, as well as skin lesions and some eye diseases. For example, Google's AI was able to detect lung cancer with 5% more accuracy and 11% fewer false positives than 6 radiologists, and an AI built by Stanford was able to diagnose skin cancer with almost the same accuracy as 21 dermatologists. Also, this website, which you can play around with yourself, allows you to put in a set of symptoms and the age and demographics of a patient, and it will give you a management plan, as well as giving you a differential diagnosis. And bear in mind that that is only version 1, and I can't wait to see what future versions could bring. So, does all of this mean that AI will replace doctors? The short answer is no, but it will play a critical role in augmenting the work of medical professionals and improving patient outcomes. Here are a few reasons why AI will not replace doctors. Firstly, AI can't replace the human touch. Doctors are not just technicians who perform tests and prescribe treatments, they're also healers who provide empathy, compassion, and emotional support to their patients. And AI simply can't replace these human qualities that are essential for building trust and rapport with patients. Secondly, AI cannot handle complex cases, and although algorithms can be trained to analyze data and find patterns, they are not so good at dealing with uncertainty, ambiguity, and variability. Whereas doctors have to deal with complex cases that involve multiple factors such as medical history, lifestyle, preferences, values, and social context. And at present, no artificial intelligence algorithm can capture all of these nuances and subtleties that affect the diagnosis and treatment of patients. AI can also not replace human judgment, and doctors have to make ethical, legal, and moral decisions that involve trade-offs, risks, and benefits. AI algorithms are based on data and logic, but they do not have the intuition, wisdom, and experience that doctors have, and it cannot account for all the possible outcomes and consequences of their actions yet. And finally, AI cannot replace human learning, because doctors have to constantly update their knowledge and skills to keep up with the latest developments and innovations in medicine. And algorithms are based on existing models and data, but they don't have the curiosity, creativity, and adaptability that doctors have. And AI cannot generate new hypotheses, test new ideas, or learn from their mistakes. Yet. And you'll notice that I use the word yet a couple of times there, because while these statements are true at present, I think it would be naive to assume that AI would never achieve these capabilities. And there's a saying right now that blows my mind every time I think about it, because right now at this moment in time, AI is the worst it will ever be, because it will only ever improve. And that's the possibly scary thing. But the next big question is, how will AI augment the work of doctors? Firstly, it can improve efficiency, because it can help doctors save time and resources by automating routine tasks, such as screening images, analyzing tests, and generating reports. This can free up doctors to focus on more complex and meaningful tasks, such as communicating with patients, collaborating with colleagues, and solving problems. Secondly, AI can improve accuracy, because it can help doctors reduce errors and improve quality by providing more reliable and consistent information, such as diagnosis, prognosis, and treatment recommendations. And this can help doctors make better decisions and avoid unnecessary interventions. Thirdly, AI can improve accessibility, because it can help doctors reach more patients who lack access to quality healthcare services, especially in remote and underserved areas. It can also provide guidance and support to those local health workers who can then perform basic tasks under supervision of doctors. So what do you think? Will AI replace doctors, or will it just augment them? And while you're thinking of that, bear in mind that 90% of this script was actually written by ChatGPT-4, including the concept that AI would not fully replace a doctor. So I'm curious what you made of this script, because honestly I thought it was pretty good. And if you're interested in more videos like this, you could check out this video on Google's AI products, or this one on Apple's health products. And I will catch you next time. See ya!